CU Medicine Vascular Surgery provides comprehensive evaluation and the most advanced treatment options for a broad spectrum of vascular conditions, ranging from the most common to the most complex, including peripheral arterial disease, PAD, abdominal aortic aneurysms, carotid artery disease, and more. Their comprehensive approach to vascular care encompasses targeted medical therapy, minimally invasive interventions, and traditional surgical procedures. Only vascular surgeons are trained in all of these areas to offer therapy that is best suited for each individual patient.
I had a wound, an ulcer, a decubitus ulcer in my left ankle that wouldn't heal. The ulcer was very limiting in the sense that it was painful. Had a lot of dressings and changes to do, but mostly it was pain and sore. It limited my ability to walk very far because shoes rubbed on it. It wasn't major, but it was certainly an interference.
Professor and Chief of the Division of Vascular Surgery and Endovascular Therapy at the University of Colorado, Dr. Donald Jacobs, tells us more.
One of the things that sets us apart is that it's an academic practice, and so we are the only academic vascular practice in the state of Colorado, and for quite a large region. And that means that we deal with things that are maybe more complex, things that are above the level of some of the other hospitals, but also that we do research, and we have clinical trials, and we have access to sort of therapies that may not be available elsewhere.
CU Medicine Vascular Surgery is excited to announce the opening of their new outpatient clinic located adjacent to the University of Colorado Hospital in Aurora.
We are not just at University of Colorado Hospital here at Anschutz, but our practice extends to Highlands Ranch Hospital. We also staff the VA Vascular Surgery Service, and now we have the new vascular surgery clinic here in Aurora. So we have a clinic here where it's easy to come and see us and get the imaging that you need for follow-up and even for initial consults and diagnosis. Parking right at the door, not a lot of the runaround you get maybe getting into a hospital-based clinic. But we also do procedures here, and that's relatively new in vascular over the last 10 years or so, where procedures that were previously thought to just be within the purvey of the hospital, with new technology and again the minimally invasive nature of it, are safe and effective to do in a setting like this. And so it's much more a pleasant experience for the patient, come in, getting some sedation, having a 2 or 3 hour procedure, waiting for a little recovery time and going home that same day. And it also is a lower cost way to provide care than what we would typically do in the hospital.
Peripheral arterial disease is a narrowing of the peripheral arteries that carry blood away from the heart to other parts of the body. The most common type is lower extremity PAD, in which blood flow is reduced to the legs and feet. Dr. Jacobs tells us how they treat this debilitating disease.
Well, PAD is the most frequent form of vascular disease that people present to us with. And what it causes is early on symptoms where you run out of gas. The oxygen in the muscle is not getting replenished fast enough because of the blocked arteries not getting flow there. And so patients that walk away start having pain in their calf or their lower leg, and they have to rest a minute and let it catch up and clear out lactic acid, and then the muscle feels better. When it gets worse, then PAD can cause injury to the point where there's non-healing of a wound or a toe or infections that occur, and it's really a limb-threatening problem. And the treatment of that is to restore that flow. The first thought is to get imaging. We do that with ultrasound, typically non-invasive, which we can do here in the clinic. And then we can do the diagnostic angio, where there's a catheter placed in the arteries, and then we shoot dye with the catheter and treat it usually at that same setting, if that's something that we could treat with a balloon or a wire and that kind of technique of endovascular rather than open. The results are really good. It's partly because of the minimally invasive nature. The initial results are great, but the avoidance of a long incision or taking vein out of one leg and using it to bypass the other, something like that, means that overall the outcomes are better with endo for the patient overall.
I now have circulation in my left leg. I have pulses where I never had them before, and I can walk further than I could before without getting cramping. I've had many, many surgeries. This is the first time a surgeon waited after I was out of the recovery room and kept coming in and checking on me for an hour well into the evening to see how I was doing. To me, that's unheard of and speaks to the compassion and the ethics that Dr. Jacobs has.
The vascular surgeons at CU Medicine Vascular Surgery offer the full range of treatment options, from lifestyle modifications and medications to the latest minimally invasive procedures and complex open surgeries, making them uniquely positioned to provide the most appropriate treatment for their patients.